This is Newsbreak 26 in Southwest New Brunswick. I'm Vicki Hogarth. Here's what's happening in our part of the world. New Brunswick is in the midst of the Delta-driven fourth wave of COVID-19, a crisis compounded by the fact that the Delta variant is infecting more children than the original strain, and there is still no vaccine available for children under 12. At a press conference in Fredericton on Friday, Dr. Gordon Dow, an infectious disease expert with Horizon Health, explained why the Delta variant is infecting more children and leading to more serious side effects in young people.
What we're learning is that Delta variant certainly infects children efficiently, so it does infect children. They usually do not get particularly ill with it, which is good news, but some of them will. And some children will even get so-called long COVID symptoms. As far as transmission to others, it's also been shown that children will transmit the virus just as easily as an adult.
Although Dr. Dow said there has yet to be a child under 12 hospitalized for COVID-19 in New Brunswick, hospitalizations and deaths of younger COVID-19 patients is a trend worldwide as the fourth wave takes hold. New Brunswick reported the death of a person to COVID-19 in the 40 to 49-year-old age group on Sunday. Although New Brunswick introduced a proof of vaccination program last week, along with the return of the masking mandate, it could be weeks before we see case numbers drop due to just how much more transmissible the Delta variant is.
This virus sticks to our cells better. So those two things, having high amounts of virus in respiratory secretions and the virus being stickier, means it's twice as infectious. So that's the first thing you should know about Delta virus. The second thing is, because it's more infectious, it has a shorter incubation period. So what's an incubation period? The incubation period is the time it takes to develop symptoms after you first become infected with the virus. The original strain of the coronavirus had an incubation period of 6 days. The Delta variant has an incubation period of only 4 days. Why is this important? Well, this is important because we have less time to contact trace and isolate people who have come into contact with the virus. The third piece of bad news is one dose of vaccine is not effective for this virus. You need to have 2 doses of vaccine to gain protection. And the fourth piece of bad news is the Delta variant appears to be more likely to lead to hospitalization and death, especially if you're unvaccinated.
Dr. Dow says getting 2 doses of a vaccine is the best defense against the Delta variant. And the higher our community vaccination rates are, the lower the burden of the virus will be on children under 12 who still aren't eligible for a vaccine. With promising trials of the Pfizer vaccine on younger patients, however, Dr. Dow said he is hopeful the vaccine could be available to the 5 to 7-year-old age group in Canada as early as next month.
I would like to see it as soon as possible. I would hope within the next month or so, but I am not sure what the timeline will be for Health Canada.
With over 40 people in the province in hospital with COVID-19, New Brunswick has returned to a state of emergency, with people once again being asked to stick to their household bubble and a list of a steady 20 close contacts.
The situation we are facing with the fourth wave of COVID-19 is very serious. We knew there would be more cases of COVID-19 after the mandatory order was lifted in July. We expected to see an increase in infections as people moved around the province and the country. But the pace of this fourth wave is beyond what we had anticipated.
New Brunswick will stay in a state of emergency until hospitalization numbers drop below 10 and will return to a state of emergency if and when hospitalizations reach 25. New Brunswick is inching towards having 80% of the eligible population fully vaccinated, but a 90% community vaccination rate is now needed against the Delta variant, especially when it comes to protecting those under 12 who are, for the time being, still ineligible for the vaccine. That's all the news I have for you. For more stories and live-streamed COVID-19 updates for New Brunswick, follow us on Facebook at CHCO.TV.
This has been a news and public affairs production of CHCO-TV, New Brunswick's only source for independent community television.